Bismillah ar-Rahman ar-Rahim. Today we are going to talk about weak ions or weak anions. This is the total weak acids. The weak anions includes the bicarbonate and the total weak acids. This total weak acids includes albumin, globulin, and inorganic phosphates. When we measure and calculate how much charges on the albumin, this is since albumin is affected by the changes in the pH. So this is the formula to calculate how much charges on the albumin. Finally, this is the albumin multiplied by 0.25. If the albumin is 40 multiplied by 0.25 will give you 10 milli equivalent per liter as the charges. Don't mix with the osmolality, because osmolality, this is the number of osmoles. In osmolality, this is the value of albumin 40 divided by the molecular weight, which is 69 kilodalton, to give you about 0.8 milliequivalent per liter as molar. This is a molarity, the number of moles, but here the numbers of charges. The same thing for the globulins, also which is affected by the pH. Globulin is multiplied by 0.09 to give you about 2.7 or 3 milliequivalent per liter. The same thing for inorganic phosphate multiplied by 1.8 to give you 1.8. So to sum up, this is albumin plus globulins plus inorganic phosphate. The total weak acids will give you about 15 to 16 milliequivalent per liter. This from the electron neutrality, we have to take care that there is a good relation between this total weak acid and the bicarbonate. Total weak acid and bicarbonate, the two together give us what we call the buffer base, which is about 40 milliequivalent or 40 hydroxyl group. So this is a very important point. The increase in this will be associated with decrease in that, and vice versa. This is a normal. Imagine that there is some sort of hyperphosphatemia. Phosphate is increased. This will be associated with concomitant decrease in the bicarbonate. Instead of 24 to come down. And also, the two together will form the buffer base, which is 40, because this is an electron neutrality between these two groups, total weak acids and bicarbonate. If the patient is having hypoalbuminemia, as I mentioned before, hypoalbuminemia will be associated with concomitant increase of bicarbonate. Decrease in the albumin 1 gram will be associated with increase in the bicarbonate 2.5 milliequivalent. So this is a very important one. So decrease in the albumin will be associated with concomitant increase in the bicarbonate, as we have mentioned before. 1 gram decrease of albumin will be associated with concomitant increase in the bicarbonate 2.5 milliequivalent. So this is should be considered while we are discussing the ABG.